Welcome to Wonder Hair Career Institute Online. My name is Livina and I'll be your instructor for today. And today we're going to talk about hand and nail care. Hand and nail care. On your exam day, you will have your instructions for this skill that reads this way. You are asked to provide hand and nail care to one hand. That's it. And this skill, again, is live person. It's not mannequin. So you'll be given your instruction card and you will see hand and nail care. So we'll start again by going through the checklist to know what we need to do. We'll start again from number 3 of this checklist. Use water of safe temperature for soaking fingers or hand. Again, if you are using any skill, doing any skill that involves water, you want to make sure you check the temperature. And you want to make sure that the patient checked it also. Place fingers or full hand into basin of water to soak before removing residue from under the nails. Clean hand surfaces using wet washcloth. Cleaning between fingers, and if soap used, rinse or remove soap using a clean soap-free wet washcloth. Use flat edge of orange wood stick to remove residue under tips of each fingernail, and remove residue from edge of orange stick if present before using again to clean under another fingernail. If you cleaning after soaking the hand in a basin of water, remember what we said when we're doing foot care. You want to make sure you bring that hand out from the water after soaking. Place them on the towel that you have on your overbed table. Then with your wet and soapy washcloth, then you clean that hand. Not inside that water. Remember, it's the same water that you're going to use to rinse. You wash this finger, okay? And when you scrub this finger, you wash them, then you rinse. After you rinse, you want to clean the, under the fingernails with what? Orange stick. If you see your orange stick, you will notice that it's one pointed edge and one flat edge. Please don't use the pointed edge. You need to use the flat edge of the orange stick to remove residues under the tips of each fingernail. This is critical. Now, rest resident hand on barriers such as dry towel once removed from basin while providing nail and hand care. I just said it. When you soak your hand or your patient hand in the basin, you have to remove it before you start washing. Dry hand before completing care. Leave nail smooth. Apply lotion to clean hand after nail care finish. Support resident hand if raised off table when providing nail and hand care. Remove visible excess lotion from hand if present and completion of hand care. Complete skill having rinse, dry, and stored basin. Placing soil linens in hamper. Disposing of trash, disposing of or storing emery board and orange stick, and leaving overbed table dry. When you doing this skill, you need to know your supplies. You need emery board for filing. You need the orange stick for removing any residues in the fingers. Remember the critical point. You don't want to use the pointed part of that orange stick. you must use the flat edge. The emery board, you are using the emery board to smoothen that fingernail so that it is smooth. Remember, as we did with the foot care, you wash, you dry, you rinse, you put what? Lotion. Critical point, flat orange stick. You want to file it to keep it smooth. I think this particular tool is very, very important. And when you put lotion, you want to make sure you remove excess lotion with the towel. Leave that patient in a very comfortable position. There is nothing much to talk about neck care, but we have to do few questions. When trimming a resident nail, you accidentally cut his or her finger. This is considered which of the following legal terms? Abuse, physical abuse, malpractice, assault, or negligence? Yes, the answer is what? Negligence. You have to be careful. It's negligence. What is the purpose of an orange stick? It is used to push back the cuticles. You push it back. Remember, we still use it to clean, take away the residues under the nails. And that is something I forgot. When you cleaning at the tip of the fingernails, remember you must clean that orange stick on the towel before you use it on the next fingernail. That is critical. This is avoid cross-contamination. You must clean it on a towel before you use it on the next fingernail. Mrs. Green fingernails are very long, unless it's an assistant assigned to this patient. The nurse's instruction did not include trimming of this patient's fingernail. What should Alice do? Do you want to go ahead and trim it because Mr. Green can be, so that she can be more comfortable? I think the answer should be to report what you observe to the nurse. Nurse has to tell you whether to trim it or not. If there is any information in the patient's chart that says, don't trim Mrs. Green's fingernails, the nurse is the one that will pass that information to you. Which of the following is not true about fingernail care? Some agencies do not allow nursing assistant to trim the fingernails of diabetic patients. True or false? True. Nursing assistant must be given permission prior to trimming a patient's fingernail. True or false? True. Nursing assistant should look for signs of jagged edges in ingrown nails and infection. True or false? True. Nursing assistant will use a back and forth motion with the nail file to shape and smooth a patient's fingernail. Is that true or false? It is false. You will file the patient's nail, not with the back and forth motion. You have to trim it to get the edges smooth. Whatever back and forth motion is, please, you are not supposed to use back and forth motion. What is the risk in trimming the nails, especially the toenail of a diabetic patient? 1. Diabetic patients often have a clotting disorder and can lead to bleeding. 2. The nails of diabetic patients are brittle and often crack beyond the quick. 3. Diabetics are more prone to ingrown nails. 4. Poor circulation in the extremities makes the patient prone to infection. This is the correct answer. If you trim a diabetic patient toenail and you cut that patient, if the patient have infection, again, it is very, very difficult to treat. And as a matter of fact, CNAs are not supposed to cut diabetic patient toenails. Even the nurses might not be able to do it. Most times it is a podiatrist that take care of those patient toenails. Thank you for watching. I hope you enjoy these little tips. And if you do, please subscribe and hit the notification button. Good luck in your exams. Thank you.